Hello friends, in this video I will let you know that how to approach the hypertensive patients. When the patient comes to you with some complaints, these complaints may be like headache in the posterior part of the head, anxiety, fine vibrations in the hand called tremors, dizziness, palpitation, fatigability, somnolence, confusion, nausea, vomiting, visual disturbances, and impotence. All these are called symptoms. After hearing all these symptoms, the doctor thinks about the blood pressure. Remembering some standards, the doctor measures the blood pressure. In this patient, 200 is the systolic blood pressure and 100 is the diastolic blood pressure. Blood pressure should be measured in both arms, in supine, sitting and standing positions. Blood pressure is written like this. Millimeter of mercury is the unit to measure the blood pressure. The measured blood pressure is classified according to this table. Systolic blood pressure less than 120 and diastolic blood pressure less than 80 is considered as normal. Systolic BP 120 to 139 and diastolic BP 80 to 89 is classified as prehypertension. Systolic BP 140 to 159 and diastolic BP 90 to 99 is classified as stage 1 hypertension. Systolic BP more than 160 and diastolic BP more than 100 is classified as stage 2 hypertension. Systolic BP more than 140 and diastolic BP less than 90 is classified as isolated systolic hypertension. The blood pressure of this patient will be classified as stage 2 hypertension. Some relevant patient's history is asked by the doctor to the patient, like duration of hypertension, drug history and its response and side effects, family history of hypertension and any cardiovascular disease, dietary and psychosocial history, other risk factors like weight change, dyslipidemia, smoking, diabetes, physical inactivity, etc. History of renal disease, muscle weakness, snoring, symptoms of hypo and hyperthyroidism must be asked. Evidence of target organ damage should be asked, like transient ischemic attack, stroke, transient blindness, angina, myocardial infarction, congestive heart failure and sexual functions. Physical examination. The patient's height and the weight should be noted. The neck of the patient should be palpated for enlarged thyroid gland. The sign of hypo and hyperthyroidism should be assessed. The retina is the only tissue in which arteries and arteriole can be examined directly. With increasing severity of hypertension, the progressive fundoscopic changes includes papilloedema, arteriolar light reflex, arteriovenous crossing defects, hemorrhages and exudates. The heart should be auscultated for aortic, pulmonic, tricuspid and mitral areas. Closure of atrioventricular valves creates first heart sound and closure of aortic and pulmonic valves creates second heart sound. In hypertensive patient, the second heart sound is loud. When the atria is contracted against the non-compliant left ventricle, the S4 gallop is heard. The apical impulse situated at the fifth intercostal space along the midclavicular line should be examined. If there is left ventricular hypertrophy, the apical impulse becomes laterally displaced. The sign of congestive heart failure should be evaluated. The examination of femoral pulse should be done by lying down the patient on the examination table. The dorsum of foot can be examined for dorsalis pedis artery. An abdominal bruit, particularly a bruit that lateralizes and extends throughout systole into diastole, raises the possibility of renovascular hypertension. The kidneys of patient with polycystic kidney disease may be palpable in the abdomen. Femoral artery should be examined for femoral bruit. The carotid artery should be examined for carotid bruit. The careful neurological examination should be carried out. The basic laboratory tests for initial evaluation should be performed in hypertensive patients. The status about the kidney can be achieved by the microscopic urinalysis, albumin excretion, serum blood urea nitrogen and creatinine. Some idea about endocrine system can be achieved by serum sodium, potassium, calcium and thyroid stimulating hormone. The metabolic functions can be assessed by fasting blood glucose, total cholesterol, HDL, LDL and triglycerides. And finally, don't forget about hematocrit and electrocardiogram. Treatment of hypertension, lifestyle modification to manage hypertension, weight reduction, attain and maintain body mass index less than 25 kg per square meter. The BMI can be calculated by weight is divided by height in meters square. Modest weight loss can lead to a reduction of blood pressure and an increase in insulin sensitivity. Dietary salt reduction means the salt should be less than 6 grams per day. This may reduces the systolic BP by 3.7 to 4.9 and diastolic BP by 0.9 to 2.9 millimeters of mercury. Adapt DASH dietary plan. DASH means dietary approaches to stop hypertension. Diet rich in fruits and vegetables contains potassium, magnesium and fibers. Low-fat dietary products are an important source of calcium. Moderation of alcohol consumption. For those who drinks alcohol can consume less than or equals to 2 drinks per day in men and less than or equals to 1 drink per day in women. Physical activity. Regular aerobic activities like brisk walking for 30 minutes per day is advisable. Stay tuned for my next video about pharmacologic therapy for hypertension. Thanks for watching.